You're headed to Resolute Health Hospital to have your baby. Whether you think you're in labor, need to be checked, or if you're sent from your doctor's office, it's best to go through the emergency room on the first floor. They'll take you to labor and delivery. If you have a scheduled delivery or special testing for labor and delivery, you can skip the ER and head to registration, where you'll be greeted by a member of our patient care team. It's best to go to admitting before coming up to the labor unit. Even if you are pre-registered, admitting will activate your account and place a patient identification band on you. Labor and delivery, which we call the nest, is located on the third floor. When you arrive, press the doorbell and you'll be greeted by a member of the labor and delivery team. Once inside, your nurse will take you to your room. If you're coming to us from an evaluation or to rule out labor, the nurse will collect your information and run some tests if necessary, as well as monitor your baby before calling the physician. If you're in labor, your doctor will give orders to admit you or send you home based on the nurse's report. If you're admitted during labor, you'll be moved to a labor suite. The nurse will place a fetal monitor on your belly to check your baby's heart rate and check the progression of your labor. If you are being admitted, the nurse will collect your information, have you sign consent forms, and an IV will be started. Whether you're in labor or having a cesarean, you'll be able to consult with an anesthesiologist. The anesthesiologist will explain pain management options and answer any questions you have. They'll visit with you even if you're not sure you're wanting an epidural for labor to address any questions you might have. After birth, you and your baby stay in the delivery room for about 2 hours to make sure you are doing well and your baby is transitioning to life outside the womb. The first hour after birth is considered the golden hour. Limited visitors are allowed so you can have private time for skin-to-skin bonding and the baby's first feeding. Within the first 2 hours after birth, your nurse will administer antibiotic ointment into your baby's eyes to prevent infection and a vitamin K shot to the thigh to prevent rare bleeding problems. Your baby will receive a bath at your bedside after a minimum of 8 hours of life. After recovery, you and your baby will be taken to your postpartum room where you will remain together for the rest of your stay. Nurses will check on you often. Your provider or provider on call and your baby's pediatrician will visit every day until you go home. If your baby is premature or requires extra attention, they will be taken to our neonatal intensive care unit, or NICU. Resolute Health Hospital has the only Level 3 NICU between San Antonio and Austin. The NICU is down the hall from your delivery room on the same floor. We'll make every effort to help you visit your baby as soon as possible. You'll have easy access to your baby who will be close by. Once you and your baby are ready to go home, you will be discharged. If your baby has to stay an extra night and you have been discharged, you and your baby may be able to stay in the same postpartum room. If your baby is in the NICU and you're discharged, speak to your NICU nurse. They may be able to find you a way to stay close to your baby. It is vital that you follow all of your doctor's instructions regarding diet, activity, and any medications you may need after discharge. If you have an outpatient appointment with our lactation nurse, her office is located on the third floor inside the nest. You will be asked to return in 7 days for a newborn screening heel stick. Please go to admitting first, on the first floor, and they will direct you to our outpatient lab, which is located on the first floor. Having a baby is an experience you will never forget. If you would like to come see the amenities for yourself, please call 844-815-1858 to schedule a tour.